Hi everyone. It's a pleasure to be here. I'm a bit nervous, so I'm wondering if you can all join me in maybe taking a deep breath in and exhale out. Thank you. So again, my name is Max. I am a substance use therapist who works in community, and I just quickly want to give a shout out to Jody and Michael and the planning committee for bringing us all together. This has been a wonderful 2 days, and it's also a pleasure to be sharing this panel with my lovely colleagues from the East, and yeah, it's just a pleasure to be here. Do I press this one?
Yeah.
Wonderful. So I would like to acknowledge that I myself am an uninvited visitor gathering on unceded, ancestral, and occupied traditional lands of the Musqueam, Tsleil-Waututh, and Squamish nations of the Coast Salish peoples. We are grateful to the Indigenous people of Turtle Island who have cared for these lands since time immemorial. We hold our hands up in their amazing resilience, and strength in the face of ongoing dispossession and colonial violence. And I want to thank my friends from Camp Out who helped with that land acknowledgement. So, what do I do? I work with Vancouver Coastal Health, which is one of the health authorities here in British Columbia. And within that authority, I work at a community health center called Three Bridges. Three Bridges serves all folks that are living on the downtown peninsula or Vancouver Centre, and we have a variety of services. On the top floor, we have home health, outreach services, and some other community programming. On the fourth floor, we have primary care, and on the third floor, which is where I live, we have mental health and substance use. So I'm on the substance use service side. And we are all concurrent disorders counselors. And the tenets of our work are always based in harm reduction, being LGBTQ2S+ competent, being trauma-informed, and reconciliation-focused. And if you want to ask some more questions about how we do that, I'd be happy to talk about that later. So, breakdown. In substance use services, we do a plethora of things. Mainly, one of kind of our biggest services is that every day, Monday to Friday, we do an intake service in which people can self-refer, come to our space, they meet with a counselor, we kind of go through some paperwork stuff, get some information about their substance use, and then we can provide them with either options of substance use care in the community, the programs that we run in-house, or we can also just provide a brief 30-minute counseling session. And people can come to intake as much as they want, as many times as they want. We also have a wait list, a caseload for individual counseling where we can see people about 6 to 9 sessions. We have drop-in group programming, so after you've done intake, you can come back to Three Bridges and we have drop-in groups every day throughout the day, which are all harm reduction focused. We collaborate with a lot of organizations, but two which I'm very, very excited about is that we're starting to collaborate with the BCCSU, and we've also recently joined in partnership with the Corner program, which is an outreach, case management, and support service for folks who work in the sex economy. If you have more questions about the Corner, please find Gwen, and they would be happy to answer your questions. Sorry to put you on the spot, Gwen. And then finally, kind of what I'm here to talk about today is we run a day treatment program called VAMP. So VAMP stands for the Vancouver Addictions Matrix Program. And VAMP, I'm going to talk a little bit about the history in a bit, but just to give you a brief understanding, within VAMP we have 2 different streams. We have an all-gender stream, which is for anyone who identifies as any gender or sexual person on any spectrum. Really, it's for everyone. And then we have a specific gay, bi, queer men's stream, which is, of course, inclusive of folks of varying gender spectrum and who also identify as trans or two-spirit. And so within that role, I am one of the co-leaders of the Gay, Bi, Queer Men's Program. So within VAMP, I'll break it down for you. So as a treatment program, when people enroll, it's 16 weeks long. Every week there are 3 therapy groups per week, 2.5 hours long, and then you also do one-on-one counseling weekly for those 16 weeks. It's a pretty intensive program. I mentioned before that the foundation of 3 bridges, especially in substance use, is harm reduction. However, VAMP is an abstinence-based program. I know I'm on a panel in which we're talking about harm reduction, but I guess I love controversy. As is in line with all of our programming, people self-refer, so they come to our services saying that they want to join VAMP. So it's important for me to acknowledge that the people who are part of our services, we're not forcing abstinence onto anyone. It's something that people are looking for themselves. And I think what probably puts me in line with the wonderful people on this panel is that through our data collection, we found that about 80% of the folks who are seeking our support services are looking to have recovery support for PNP, or problematic sexualized substance use. So maybe it would be helpful if I also gave you folks a little bit of a history of the VAMP program. So VAMP has been around for 12 years, and it is a evidence-based manualized program, which is taken from the matrix, so the M in VAMP, matrix model, which comes from the States. It was developed in the 80s during, I think, what some researchers has called kind of the stimulant crisis of the 80s. A lot of folks, I think, during that time were having a lot of problematic relationships with stimulants, and so a group of researchers came together and developed this program. It's been utilized with thousands of stimulant substance users, and I think I'm proud to say that it is evidence-based, which is wonderful. Within the model of the Matrix program, and how it works within our group model is that there's kind of 3 key components. So within VAMP, on Tuesday and Friday, the group is separated into 2 halves. We have an early recovery portion, which focuses on early recovery skills for folks, so scheduling, how to avoid triggers, how to manage kind of risky situations, and how to foster and develop better relationships with people in your social circles. And then the second half is called relapse prevention, and that is a part of the program which kind of goes a lot into actually what the themes of what Vincent was talking about in his program, of that we have a session that we're talking about sober sex. We have sessions where we talk about shame and shame, tolerance, and shame within our own community. We have a session on HIV. So kind of understanding the intersections of what does it mean to be queer individuals who are also in recovery, but living within a community that has a long history of intersectional oppression. The other model in which we use is something called the Getting Off Manual, which is also from the States, and it was developed in 2007, I believe, and it is a gay, queer man-specific cognitive behavioral therapy, which is culturally tailored towards queer men and specifically emphasizes on issues of HIV and harm reduction. So, back to VAMP. VAMP was started about 12 years ago in 2007, and it was first developed within VCH as a pilot project to focus on 2 specific populations, gay men and at-risk youth. Due to changes within the substance use department, the youth program unfortunately fell away. However, the gay men's program remained. In about 2010, we got the green light from VCH, and we got permanent funding for our program. Within this time, through conversations that we're having in community, people who were facilitating the program kind of talked and decided that gay men was very narrow of a description of the people that we serve, so they called it gay bi men, which is still a little bit narrow, but we'll talk about that later. In about 2012, we received feedback from service users that we need to start a program for folks who did not identify as queer as men, so that is how we started the All Genders program. In the last year or so, we've developed, or we've broadened the name of the VAMP program to gay, bi, queer men. However, I need to acknowledge that this conversation of language is ongoing, and it's something that's still a struggle because, and I wonder if other folks who work at ASOs or other queer organizations are kind of going through this themselves of kind of like how does your language reflect the demographic, but also the specific work that we do. So I want to just say that we're not perfect, but we continue to try. Oh, wow, amazing. So what do I want to say? So I guess the question is, why does this all matter? And especially, why does it matter that I'm at this conference? I think the conversation that I hope that we can have during our discussion period is when it comes to the healthcare system and the queer community, when we think about access and accessibility, there's a lot of shortfalls when it comes to working with folks who are trying to recover or get support from their substance use. So some of the barriers to service, which I hope you folks can think about and maybe we can talk about later, are kind of what are the barriers when it comes to the healthcare system? How do we make things much more low barrier? How do we reduce cost? How do we make things culturally competent? Understanding the biopsychosocial issues which face many LGBTQ2+ men, and also how do we bring in a lot of more complex issues such as trauma and grief around people having to let go of either their substance use or sexual practices. And then even expanding that to the broader queer community is in thinking about the spaces in which queer men meet, which are very often highly pervasive of substances, highly sexualized, often void of emotional vulnerability, and also can replicate stigma and shame that we already face in our community, I think are just things that I often think about, and I hope that we can talk about that more later. So thank you very much. Again, it's a pleasure to be here, and I hope that you have a wonderful day.